One TV special report.
A pleasant morning to all our esteemed guests and partners. Welcome to this momentous event as we formally introduce to our PhilHealth members in OZAMIZ, PhilHealth's newest program na tinatawag po nating Konsultasyong Sulit at Tama Benefit Package. Today, we have invited esteemed guests from our partner healthcare facilities, our institution, and media partners. Hello, good morning to witness this special occasion. I am Merlin Ibanez of PhilHealth Regional Office 10 and your host for today. Before we proceed, we would like to acknowledge first the presence of our guests and partners. Kani siya, very active, very beautiful, gorgeous, nasa kanya na lahat. And Forever 21, Dr. Ami Adona Tagalugin, the Chief of the Adona Tagalugin Hospital, together with Dr. Benicio Adona. Hi, Doc. Good morning. Please stand to be recognized. And of course, this morning's program will not be possible without the support from the local health insurance OZAMIZ office headed by Ma'am Fetsi Gomila. Please stand, ma'am, to be acknowledged. Ma'am Fetsi, yun. Forever 21 gihapon na si Ma'am Fetsi, di ba? Tanawa ang mga beauty ani nila. And of course, together with his competent and active personnel, Miss Daisy Tapitan, the Leo Information Designate here in Leo OZAMIZ. And of course, where's AG? AG Christian Pausanos and the beautiful Sterlita Pearl Labuca. And Chilette, yun, where's Chilette? Chilette Labastida. From the regional office, headed by the action man ng PhilHealth, please help me welcome the Regional Vice President Delio ARON II. Together with Ma'am Dina Cabana, representing Local Health Insurance Office, Cagayan de Oro City. Ma'am Dina? And of course, our speaker this morning, Dr. Francis Ramos. And our Executive Assistant representing the Office of the Regional Vice President, Mr. Patrick Piñaranda. And from the Public Affairs Office, we also have here Ms. Pam Orias. Ms. Pam. And we would like also to acknowledge our media partners joining us today. Happy kaayo mi nga nakaabot mi dinhi sa OZAMIZ og nakita ta mo face to face. Kay usually gakakita lang ta murag voice lang, di ba sir? Voice lang kanang mga sana siya nga mga interview, phone patch at saka sa virtual, di ba? So karon nakita na nako ang mga active na media dinhi sa OZAMIZ. That's why we're so very excited this morning. So I would like to acknowledge and of course thank you very much sa inyong presence. From DXOC, Ma'am Rosal Delia, hello. And of course, kanisuki kayo ni nako, sige ni siyang panawag. From DXDD, Mr. Manuel Ronquillo. Finally, sir, nakita na gyud ta. And of course, ang suki sa tanang mga suki from Philippine Information Agency, Ma'am Shaina May Nagtalon. And from MBC, we have Expedita Tata Rojas, Mindanao Broadcasting Corporation. And of course, from One TV, kani. So, si Daisy sigig starring at diri sa One TV as well as Ma'am Fetsi. Please help me welcome Adoni Desena. And the manager, we are very glad this morning. Andito yung manager ng One TV. Hello po, Mr. Johnny Tommy. Hello, thank you so much, sir. Na ba kayo na-miss? Wala na? Wala na po. And the partner of Ma'am Tata, sino po? Mr. Rexel. Hello, Mr. Rexel. Naka-live pa po tayo sa DXDD. and then Juan TV channel, MBC, and DXDD FB. So to formally welcome us all, may we call on Ma'am Fetsi Gomila, the Local Health Insurance Office Chief here in OZAMIZ City. A round of applause, please.
Thank you, Ma'am Lynn. To our PRO, Vice President, Action Man, Mr. Delio Aceron, from Accreditation and Quality Assurance Service, our Consulta Region 10 point person, Dr. Francis Ramos, and Executive Assistant, Mr. Patrick Peñadero, malibog yung ano yung Peñaranda, our Chief PAW, Ms. Marilyn Ibanez, with her staff, Ms. Pam, of course, Ms. Dina Cabana, head of Carmen, PBC Carmen, Cagayan de Oro City, to Dr. Benny Adona, Doctora, the ever beautiful Doctora Amy Adona, to our partners in the media, and to everyone watching. I am Fetsi Gomila, leading in greeting you a pleasant morning and welcoming you in this morning's press conference as the Chief of PhilHealth OZAMIZ City. Protektado ang kalusugan ng bawat Pilipino. Sa pinalawak na benepisyong pangkalusugang handog namin sa inyo, in the implementation of the Republic Act 11223 or the Universal Healthcare Law of 2019, and as an initial step towards adopting a comprehensive approach through the PhilHealth Board Resolution number 2479 to expand the primary care benefits to cover all Filipinos. As an overview, the PhilHealth Consulta package covers individual-based health services including health, initial and follow-up primary care consultations, health screening and assessment with access to selected diagnostic services and medicines. The package focuses on the responsive financing mechanism in accessing primary care service and commodities in line with it. PhilHealth Leo OZAMIZ utilizes its resources to reach out and enlighten every Filipino in regards to the Consulta package, together with our potential Consulta providers, and to insist in the delivery of quality, primary, and services to our members and qualified dependents. We continue to adapt to the times in order to continue providing the quality services every Filipino deserves. I greet you once again with a pleasant morning from PhilHealth OZAMIZ, your partner in health. Thank you.
Thank you very much, Ma'am Fetsi. You know what, ladies and gentlemen, despite these challenging times, PhilHealth, the premier social health insurer in the country, has always aspired to do what is best for its members. So in collaboration with its partners, of course, surely what we are about to witness this morning as we go along demonstrates our utmost commitment to securing the health of every Filipino family and our firm dedication to public service, even in the midst of global pandemic. That's why we are here this morning. So at this point, may we hear a message, an inspirational message from our very own, the action man po ng PhilHealth. So once again, a round of applause to our Regional Vice President, Mr. Delio Aceron II.
Yan. Magandang umaga po sa inyong lahat. Itong araw na po ito ay napakahalaga para sa akin, para sa mga kababayan natin sa OZAMIZ. Kasi po, dito po sa OZAMIZ City, para sa akin, this is a lucky charm po pag ako po ay bumibisita dito. Unang bisita ko po dito last year, ako po ay na-appoint na as the Regional Vice President. Ang pangalawang bisita ko po dito, ako po ay na-reappoint ulit. Dapat ililipat po ako sa ibang lugar. And of course, maraming pagbabago, bago local chief executives. Nais natin may pagpatuloy ang ating mga ginagawang mga reforms at ating information drive, pag-implement ng universal healthcare sa Northern Mindanao. Hopefully, sana po mabigyan pa rin po tayo ng pagkakataon pag tayo po ay nagkaroon ng bagong President and CEO sa PhilHealth para po tuloy-tuloy ang ating dekalidad na serbisyong ihahandog sa ating mga kababayan. I'm also celebrating my first year anniversary po as the Regional Vice President of Northern Mindanao, PhilHealth Region 10. Una sa lahat, maraming salamat po sa mga sumusunod. Tagalogin-ADONA POLYMEDIC and Diagnostic Center, our first private facility na konsulta provider na accredited po sa buong Region 10. Tama po yan. They hold that distinction. Sila ang unang private facility na konsulta accredited. Led by, of course, Dr. Benny and Dr. Ami Adona at ating mga staff. Maraming salamat sa inyo. Maraming salamat rin sa ating masipag na leaderhead dito po sa OZAMIZ, si Ma'am Fetsi Camila, Daisy at iba pa. Ang aking mga kasamahan sa Regional Office, Doc Francis Ramos, ang ating consulta point person ng Pro 10. Parang yan po ay walking encyclopedia, napakagaling, napakatalino, and PhilHealth is lucky to have a dedicated doctor like him sa Region 10. Hindi lang po magaling, magaling din kumanta at sumayaw. At magandang lalaki din. And of course, si ating Ms. Lina Banyas, ang ating head sa Public Affairs Unit, kasama si Pam. Ma'am Dina Kabalang, ating OIC sa PhilHealth Business Center, Carmen. And ang aking Executive Assistant, Mr. Patrick Peñaranda. And ang ating mga kasama pong local media partners. Maraming salamat sa pagbibigay oras sa ating pagsasama ngayong umaga. Nandito po ako sa inyo ngayon para hingin ang tulong nyo at suporta. Kailangan po tamang impormasyon. Gabay natin sa ating tamang pagdesisyon at aksyon. Nais ko pong ipaalam sa inyo na kailangan tulungan nyo po kaming ipaalam sa ating mga kababayan, especially dito sa OZAMIZ, na magkaroon ng paradigm shift o pagbabago ng pananaw o prioridad na kailangan pahalagahan natin ang ating kalusugan. Kailangan tayo po ay magpa-check up para maagapan agad at huwag lumala kung tayo po ay may masamang nararamdaman. Para sa simula pa lang, makontrol natin ang ating high blood o huwag natin mapabayaan ating blood sugar o kaya mag-lead ito diabetes. Alam naman po natin, pag napabayaan natin ang high blood natin at diabetes, dumarami po ang kababayan natin ngayon na dinadialysis. Makikita natin dito, PhilHealth is investing to more on preventive package. Not curative. Kasi ang batikos noon sa PhilHealth, hulog ako ng hulog sa PhilHealth, di ko naman siya nagagamit. Nais kong linawin, yung contributions na hinuhulog nyo, kung hindi po kayo nagkakasakit, kayo po ay nakakatulong sa kababayan nating masasakitin. Dahil ang PhilHealth po ay social insurance. The healthy subsidize the sickly, the young subsidize the senior citizens also. So hindi rin natin alam kailan tayo maaaring magkasakit o maaksidente. Ang importante, meron tayong programa na masasandalan na may makukuha tayong kabawasan sa ating hospital bill. At ito po ay malaking bagay. Napakahirap at napakamahal po magkasakit ngayong panahon. At alam niyo naman po, dialysis, 2,600 per session sagot ng PhilHealth, up to 90 sessions, na hopefully, subject to actuarial studies and additional fundings, maging 156 sessions na ito sa darating na taon. Ilan lang po yan sa mga ginagawang mga pag-aaral para mas mapaganda natin ang ating programa. Nais rin po natin hikayatin ang mga kababayan natin dito sa OZAMIZ na magparehistro na sa kanilang chosen private or government primary care provider. So dito po sa OZAMIZ, sa ngayon, ang ating private provider ay ang Tagalogin-ADONA POLYMEDIC and Diagnostic Center. So kailangan sila po ay magparehistro na at dito na po agad magpa-check up. Mamaya po, makinig po kayo sa mga lectures, of course, ni Dr. Francis Ramos. Magkakaroon din tayo ng walkthrough para maintindihan nyo. Ang suggestion ko nga, dapat kayo po mismo maramdaman nyo na dito na kayo magpa-check up at magamit nyo po ang benepisyo ng PhilHealth. Kasi yan na po ang hinanda ng PhilHealth. Konsultasyong sulit at tama. Malaki ang role ng primary care providers. Sila ang puso ng PhilHealth sa universal healthcare. Once makuha po natin ating data, at least pag nirefer po tayo sa mga iba't ibang hospital, mas madali na at mas mabilis. Kasi ang kadalasan nangyayari, masama pakiramdam natin, tumatakbo kagad tayo sa mga malalaking hospital. At nagkakaroon tuloy ng backlog at hindi na-entertain. With the primary care providers, tulad ng Tagalogin-ADONA POLYMEDIC and Diagnostic Center, matitreat niya yung mga karamdaman na kaya na po i-treat ng nasabing facility at i-refer kung ano pa yung mga dapat i-refer sa higher facilities. Aside from that, nais ko rin pong i-share sa inyo na yung press con po ngayong umaga, hindi po ako uupo dito sa harap. Kasi po sila po ang bida ngayon. Nais natin ma-focus ang inyong tanong dito sa ating benepisyong konsulta. Kung maaari lamang po, huwag muna po natin ipasok yung mga iba't ibang issues kasi tamang panahon po, tayo po ay magpapa-presscon. Nais po nating makuha nyo po mismo ano ang konsulta para yun po ay ma-relay natin sa ating mga kababayan dito. And also, nais natin na masuportahan ang mga kababayan natin na wala na pong papanaw nang hindi man lang po nakapagpatingin sa isang doktor o sa isang pasilidad. Kaya tulungan nyo pa kami na sa UAC, lahat ay may benepisyo na. Kailangan lang rehistrado ka at ituloy-tuloy natin ating pagbabayad sa ating programa. Sa aking huling pang mensahe, ito po ang naisip kong ating battle cry. Para masiguro ang kalusugan ng ating pamilya, tara nang magpakonsulta. Maraming salamat po at magandang umaga sa inyong lahat.
Thank you very much, our VP, Delio Aceron. Again, let's give him a round of applause. I know that this point, daghan kayo mong pangutana. What is konsulta? Unsa ang konsulta? Unsaon pagpa-avail? How can a members avail this benefit? Diba? Yun yung mga basic questions. So to answer your questions and jumpstart this part of the program, dili na nato dugayon. May we now call on Dr. Francis Ramos, the PhilHealth Medical Specialist and the Konsulta focal person. A round of applause, please.
Good morning to everyone. Magandang umaga po sa lahat. Maayong buntag. I'm glad to be here with all of you, and I'm very grateful for your time and attention. So before I continue, I would like to thank everyone here who made it and made this possible. And we are very grateful for your interest in our new primary care benefit package, the PhilHealth Konsultasyon Sulit at Tama, or short as PhilHealth Konsulta. So this is written in the Universal Healthcare Law, Republic Act 11223. And it states, and I quote, "Every Filipino shall be granted immediate eligibility and access to promotive, preventive, curative, rehabilitative, and palliative health services without causing financial hardship, and prioritizes the needs of the population who cannot afford such services." Such a beautiful passage in a very, very progressive law in the country. So this summarizes the paradigm shift of PhilHealth. This is PhilHealth's investment to the future of healthcare in the Philippines through the Universal Healthcare Law. So how does PhilHealth respond to the wishes of our Universal Healthcare Act? By creating a comprehensive primary care benefit for all Filipinos. So this is now what we know as PhilHealth Consulta. So PhilHealth Consulta is the primary care benefit package that is currently active today. It is the evolution of a decades-long journey of PhilHealth in exploring primary care benefit. So for those who have been partners with us for the past decade, you previously known this as our Primary Care Benefit 1, Expanded Primary Care Benefit, and now the latest iteration, PhilHealth Consulta. So the difference with PhilHealth Consulta, it now covers all Filipinos, regardless whether PhilHealth member or not, direct or indirect contributor, whether young or old, working or non-working, rich or poor, regardless of how much you contribute, as long as you are a Filipino, this program guarantees that you will be covered. And this time, PhilHealth will no longer invest more in the inpatient. PhilHealth will be investing more in the outpatient services. So why is PhilHealth doing this? For over 20 years, we have been researching on how can we better serve the healthcare services here in the Philippines. So for the past 20 years, we've been investing in the last lines of healthcare. This is why the common understanding and stereotype of the Filipino when they hear PhilHealth, ay ra magamit kung ma-admit. Kung dili ko magkasakit, walay gamit ang PhilHealth. So this has been the misconception and misunderstanding of all Filipinos. But by looking at other countries and other experiences, we found out that when you invest more in outpatient services, we actually prevent catastrophic diseases from happening. And we have learned that from other countries who have been practicing universal health care for more than 2 decades. Canada, Korea, Japan, China, Taiwan, Thailand, and most of the European countries as we know, and dozens more of countries. So by investing in the outpatient services, we prevent outpatients becoming inpatients. We help decongest our already full hospitals. If you see PhilHealth annual reports, if you see the top 10 claims that are being paid to hospitals, it actually reflects the state of healthcare here in the Philippines. Number 1 claim that is being claimed by hospitals today is hemodialysis, followed by obstetrical care, followed by neonatal care, and formerly number 1, defending champion, pneumonia. Most of these diseases or most of these conditions are preventable. And PhilHealth discovered that at one point of the development of this disease, there was a window that these diseases could have been prevented. There was a window that these diseases could have been controlled, detected, intervened early on. But what has happened is it is because of the current health-seeking behavior of Filipinos. Why do Filipinos seek healthcare so very late in the progress of disease? Number 1 concern is the cost of care. Dili sa ako magpakonsulta kay mahal kayo og PF si doktor, mahal kayo ang tambal, mahal ang pagpa-laboratory test. I will only go to the doctor if I can no longer tolerate what I'm feeling with my disease. This is why we see a lot of diabetics, a lot of hypertensives, a lot of stroke patients conditions like cancer already detected very late in the stage. So this is why PhilHealth decided to research on the outpatient setting. So we were able to gather information that what are the most common diseases that are being treated in the outpatient, what are the most common medications that is being prescribed, and what are the most common tests that are being requested. And to our surprise, these common diseases were actually precursors of the serious conditions that we now know and observing nationwide in the public, such as kidney failure was at one point just a symptom of back pain, numbness in the lower extremities, urinary frequency, which are very common symptoms but that were left undetected. Hypertension and heart disease were once at the point that they were just simple chest pain, headache, abdominal pain, simple diseases that you see every day in the outpatient setting. So this is why PhilHealth worked with our legislators, because the Philippine government back in 2015 committed to the United Nations in the development of the Sustainable Developmental Goals, which will be achieved by 2030. And in the health sector discussion, the Philippine government committed to be one of the part in the Southeast Asian countries to achieve universal health care in less than a decade from now. So that is why 4 years after the commitment of the Philippine government to the United Nations and WHO, our lawmakers and congressmen, senators, and the executive branch of the government work together to develop and put into law the universal health care. So we have still a long way to universal health care, but we are taking the right steps in the right direction. So one of the steps we can take in involvement in the universal health care is by engaging in the PhilHealth Consulta. What makes PhilHealth Consulta special to you and to our partner facilities? So what are the benefits under the PhilHealth Consulta package? Number one are the services. PhilHealth would like to cover services from healthcare facilities such as consultations and case management, provision of preventive health services, assistance in accessing services, and even patient navigation in referral to specialty and higher level of care. Basically, what we are saying is we would like better patient navigation, better patient interaction, and better patient guidance. And we would like to reimburse facilities with these services. Number two are these 13 laboratory tests. These 13 laboratory tests is a combination of hematologic, blood chemistry, microscopy, and even diagnostic imaging and electrocardiography. These are the 13 most common laboratory tests that is being requested in the Philippines for the past decade. So PhilHealth included this in our benefit package. As you can see, we can already detect a lot of diseases by these 13 laboratory tests, and early detection and screening is the key for healthier Filipinos. So before we can treat, we must know what the conditions are, and through these 13 laboratory tests, we can do so. So before solving the problem, just like the media, one must acknowledge that there is a problem. So by these 13 laboratory tests, we are able to do that. Next are these 21 drugs and medications. These 21 drugs and medications are the most common prescribed medicines in patient clinics in the Philippines. A combination of antimicrobials, anti-asthma, anti-diabetic, antihypertensives, and so on. So these medications can already treat a lot of diseases that we can prevent from developing into more serious diseases. So before, example, diabetic patients that will be dependent on insulin, we can already treat them by these medications. Those with very catastrophic hypertension, we can already treat them. Those with severe asthma, we can treat them. And we can already treat a lot of infectious diseases. So we can prevent pneumonia, serious pneumonia, urinary tract infection, skin diseases, and gastrointestinal diseases very early on. And also, we can already treat those with high cholesterol, dehydration, and those who are at risk for stroke and heart disease. So this combination of services, laboratory tests, and medications are designed to shift the state of healthcare here in the Philippines. Although very simple, but very, very significant if we put this in a national context. As you can imagine, there is a potential for all Filipinos to receive these basic primary healthcare services and will one day help the improvement of the healthcare system here and becoming healthier Filipinos. So what are the steps in engaging in the PhilHealth Consulta program? So first, there is what we now know as registration. Registration refers to Filipinos or PhilHealth members registering to a PhilHealth Consulta facility. So first, before you engage, there must be intent and willingness to involve in the program. So to register to a Consulta facility or to show intent to engage in PhilHealth Consulta, we have two types of registration. First, let me discuss the self-registration. Filipinos and PhilHealth members will soon now able to register themselves online through the PhilHealth website. So all they need is to put in their general information and including their PhilHealth identification number, and these are enough to register them to a Consulta facility.
One TV special report.